Hi, good morning. I'm Dr. Maddie Deutsch, and I'm the Medical Director for Transgender Care at the University of California, San Francisco. And I will be speaking today about approaches to caring for transgender people who are living with HIV. It's an honor and pleasure to have been invited to give this presentation. I'm going to very quickly discuss some terminology before getting into some epidemiology and then some specifics about medication prescribing and other considerations. But just to make sure folks are familiar with terms, transgender person is someone who has a gender identity that differs from their birth assigned sex. Someone who has what we refer to as gender dysphoria as an actual diagnostic code that you can use when you're coding visits. Describes a state where this discordance between gender identity and birth sex results in distress. So really not all transgender people have gender dysphoria because a great many transgender people have undergone a variety of medical or surgical treatments and now feel aligned. But I just wanted to put that out there so you understand some of the terminology, especially when it comes to diagnostic coding. Someone who is not transgender would be referred to as cisgender. These are prefixes, trans meaning opposite, cis meaning next to. You may remember, for those of you who suffered through organic chemistry, these terms from cis and trans configurations, and maybe now that justifies why we all suffered through organic chemistry.